It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area, Candace, that help change people's lives.
You bet. Here at the Best Docs Network, we are all about helping you find the doctor that is just right for you. Now let's check in with our next doctor. It's General Surgeon Dr. Philip Swanson.
About 4 months ago, I had a gastric bypass. I was obese and having a lot of chronic issues like diabetes. 5 days later, after having the gastric bypass, I was no longer diabetic. I was not dependent on insulin or metformin or any of the other auxiliary drugs that are prescribed, no longer, and it feels good.
She's been doing really well. She came in today talking about dress sizes and how she's having a hard time adjusting to the fact that she's down to about a 16.
I have in mind what my size is, but the mirror and the clothes say something totally different. I went shopping a few weeks ago and I got 4 size 16 dresses. 4. I have not seen a size 16 in over 10 years.
It's kind of like you're on a journey and you're trying to get from point A to point B. And if you have a map, you can get there. But if you're just kind of wandering around, you may get there, you may not. So if you pay attention to what you're doing and you know what the facts are, then you can make changes.
90% has been me, but Dr. Swanson's been there every step of the way. Even though I may not have a scheduled appointment, I'm welcome here to come and see him anytime. That support is there. I can call anytime.
People come back real regularly and I talk to them. I think it's important to maintain that connection, to have the guy that you believe in, the surgeon who's doing your procedure, who knows about it, who knows the most about it, being in contact with you.
So far in my journey, I have lost close to 50 pounds. And as I continue, I hope to lose a total of 120, maybe 125.
We do the surgery, it's almost like pushing the restart button. We give people a second chance.
A lot of people don't really know what dermatopathology is. Basically what we do is if you go see a dermatologist and they look at your skin, and not always dermatologists, but mostly dermatologists, and they see something that they're worried about, or you've got a skin rash, they'll take a skin biopsy and they'll send it to someone like me to look at under the microscope to give them an answer. Basically, as a dermatopathologist, what you do is you go through training. You can either be a dermatologist trained first and then take another year or more and then you're specialized as a dermatopathologist, or you can start off as a pathologist and then take a year of fellowship training and then take an examination, and then you also can be board certified as a dermatopathologist. There are a lot of skin diseases that people can get. I mean, if you open up a textbook of dermatology or dermatopathology, there are literally hundreds and hundreds of diseases that people can be afflicted with. And so when you go see your dermatologist, you know, they're trying to figure out what you have, and so one of the things they do is take a skin biopsy. Sometimes the answer is very easy under the microscope. You can tell right away, like for example, a lot of skin cancers are real easy to diagnose. Others may be more difficult to diagnose, especially some of the skin rashes that people get. A lot of them can look kind of alike under the microscope. So we'll often call a dermatologist and we'll discuss a case with them. Sometimes they'll actually send pictures. We'll look at the clinical photographs and correlate that with what we see under the microscope. Sometimes they'll even actually bring a patient to us to see, or they'll send them to my clinic, or we'll go to a conference where the patients are there, and then we'll kind of put everything together to come up with the right answer. Our goal is to try to get the best answer for the patient, because once we make a diagnosis, then they can start treating that disease appropriately and make them better. It is a rewarding field because we do make diagnoses and we do help people, and unfortunately I don't see a lot of patients, although I do still see patients at my clinic. But a lot of times we just get the slide under the microscope and then we try to figure out what's going on there. And most of the time we actually can help the patient and come up with an answer that improves the patient's lives, and that's quite rewarding when we're able to do that, and we get feedback from the dermatologist, oh, you really helped my patient, you got the right answer, and I was able to treat them appropriately.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
Our goal here at the Best Docs Network is to help you find the doctor that's just right for you. And now we're going to meet our next best doctor. It's orthopedic spine surgeon, Dr. Robert Myles.
In spine surgery, one of the main surgeries that we've used has been the spinal fusion. The spinal fusion has been done for many years, and one of the things that we do with the spinal fusion is that we are trying to make two pieces of bone fuse together. Stem cell research has allowed us to create a fusion without taking actual bone tissue from the body. What that does, it makes it so that you don't have to have an additional incision and you don't have to deal with the post-operative problems that are associated with a bone graft. What we do to obtain the stem cells is we actually place a needle into the iliac crest rather than doing a large incision. We draw out the bone marrow that's rich in the stem cells, and then we take that and then spin it down. We then collect the stem cells and place that in the area where we want the fusion to occur with additional bone. What this allows is, or what this changes, is that we now don't have to make a big incision, which can be painful after the surgery or be deformed after the surgery. Once we've collected the stem cells from the iliac crest and we've concentrated them and spun them down, we will place them on a piece of bone like this. Basically, there's different types of bone that we use, and this is what we call cancellous bone graft. And then we'll place the stem cells in there and place this actually in the area that we want to fuse. This is a piece of allostem. This is stem cells that have been collected from fat cells and they've been placed inside a bone matrix. They're attached to actual pieces of bone. They come to us frozen in the operating room, and I take it and I thaw it out, and then I place this bone into the area where I want the fusion to occur. Now this has the stem cells impregnated in it, so these stem cells will actually turn into bone over time. This is called osteogenesis, or bone formation. Basically, the stem cell develops into a bone formation cell called an osteoblast. That cell then develops into an osteocyte, which is the mature cell. So basically what this stem cell does, it takes a lot of these cells and drives them toward forming osteocytes, which form the bone, which cause your fusion to occur. Our goal is to obtain pain freedom with stem cell technology.
Coming to see Dr. Wyatt, I was constantly clogged, my nose, constantly having to blow my nose. I was carrying toilet paper around with me constantly and was just miserable. I couldn't smell at all, had a hard time tasting, and it really affected my lifestyle.
Jenna has been a patient of mine for a long time now, and she has very serious problems with sinus infections, sinus polyps, allergies, and associated problems with asthma.
I wanted to find out what was going on so I could breathe better and be functional.
She has a lot of problems with chronic sinusitis, with the formation of a lot of polyps. It's driven by her allergic disease and underlying inflammation that she has all the time. One of the big problems she has is something I see very commonly, where sinus problems are making asthma worse.
He explained to me that I had a lot of polyp development in my nose and that he needed to remove them so that way I could breathe better and that way everything would flow more clearly and I would be able to smell as well.
So one of the things that happens to her when her sinuses start causing trouble is her asthma gets a lot worse. I would never be able to cure her, but I would be able to dramatically improve her quality of life by cutting down on the medicine she had to take all the time, improving her breathing through her nose, her sense of smell.
Dr. Wyatt has changed my life in many ways. First of all, being able to smell my own perfume. Yeah, he's definitely changed my life. I can taste food again, I can make trips with my husband, and I can have a normal life. I love being able to smell flowers.
And she's one of those people, unfortunately, that I have not been able to go in and cure with a single surgery, but because of the minimally invasive techniques that I'm able to employ now, even though she requires surgery to clear out polyps every 18 months to 2 years or so, she's able to get that done and tolerate that with very little downtime.
He is a great doctor. I love that he explains things to me well. He shows me things. He helps me out with new medications if I'm on them. He coordinates really well with other doctors. I just love Dr. Wyatt and his team. I would definitely recommend Dr. Wyatt.
For more information on any of the doctors you've seen on today's show, or to find the doctor that's just right for you, log on to our website. It's bestdocsnetwork.com.
And for the folks out there looking for the right dentist, we have one just for you. That is cosmetic dentist, Dr. Guy Lewis.
As I was aging, I guess, my teeth weren't as pretty as they used to be, so I found that I wasn't smiling as much as I used to.
You know, Sandy's a very beautiful lady. A lot of the patients I see, probably the majority of patients I see, are women, you know, over the age of 40, who a lot of times, you know, they take care of themselves, they stay in shape, they look great. But there's just some things they want to do to try to look younger. And for Sandy, you know, getting her teeth whiter, straightened up a little bit with the veneers was perfect for her.
I've seen a lot of Dr. Lewis's work and have been so impressed, so I came to see him. And I'm so glad I did, because now I smile all the time.
It just really works great for a lot of people, and she was a perfect candidate for that. It's amazing to me that doing the veneers like we did for her, which is a pretty simple 2-visit process, 2 or 3 weeks apart, what a difference it can make in how someone looks. I mean, and literally 10 or 15 years younger.
It's painless, it doesn't take long. Dr. Lewis is very sensitive to your feelings, how you want to look. He's a good listener. He listens to how I wanted my smile and my teeth to look, and he did exactly what I wanted.
It can be done so to where it's not like people look at you and go, wow, where'd you have your teeth done? But they look at you and go, man, you look great. You know, what have you done? Have you been working out more? Or you just look, for some people, if their teeth are really bad, yeah, it's going to be a noticeable change. But for other people, it's just one of those things to where you just look good, you look more alive, you look more refreshed, you just look better, but it's not just a glaring, oh, what'd you do to your teeth, you know?
My family would say, okay, what did you do? Something's different. Your smile is beautiful. Did you get your hair cut? I just feel so good about my smile now. Smiling's good. I'm not a big fan of going to the dentist, so this was a big deal for me, and I would do it again in a heartbeat.
Your family history is very important to your medical care. For example, there's a lot of cancers that run in family. These are what they are: colon cancer, prostate cancer, breast cancer, melanoma, malignant melanoma of the skin. Also, thyroid cancer and ovarian cancer tend to run in families. So if you have a first-degree family member, that is children, brothers, sisters, parents with those diseases, you need to tell your doctor so that he or she can screen you more for those diseases. Also, there's a strong family history for premature heart disease. For example, if your mother or father had a heart attack in age 70, that's not a big deal for your particular risk factors. However, if your father had heart disease or stroke prior to the age of 55, or your mother prior to the age of 65, that's an independent risk factor for you to have heart disease. Glaucoma, osteoporosis, these things tend to run in the family also. Also aneurysms, brain aneurysms. If you have more than one first-degree relative with an aneurysm of the brain, that puts you at risk for that. So anyway, talk to your family members. Ask them what they have. Tell your doctor, and then you can know what's you're at risk for.
We are here with one of the best doctors that specializes in the back and neck. He is a pain management specialist, a board-certified physician that treats problems with the back and neck. And some of your patients that come in, what are the most common symptoms?
Well, patients that come into my office often complain of neck pain that may or may not be associated with arm pain, numbness, or tingling, or shoulder pain, numbness, or tingling. They also might be complaining of thoracic or mid-back pain that may or not be associated with numbness, tingling, or pain radiating around to the ribs. Most commonly, they come in complaining of low back pain that may or may not be associated with leg pain, numbness, or tingling, or otherwise known as sciatica. What we find out is, upon evaluation of these patients, that this procedure addresses these conditions such as a herniated disc, a bulging disc, scar tissue that might be in the spine from trauma, or even patients that have already had a surgery on their back and or a fusion of their back that still can be treated with this minimally invasive procedure.
Dr. Williams is one of the only specialists in the world that does a minimally invasive procedure that can detect and treat neck and back problems. Explain this procedure.
What I do is I make a very small 2 to 3 millimeter incision in a natural opening above the patient's tailbone without damaging any bone. It also has a laser, a state-of-the-art laser, and a high-definition camera that I can drive up to the patient's, into the patient's spinal canal and examine the patient's spine for herniated disc, bulging disc, scar tissue, inflammation, and then treat that patient's pain or a condition right there.
All right, Dr. Williams, so I have the procedure on my back or neck. What about the recovery time? How long?
Well, I'm glad you asked that, Jim. Since it's such a minimally invasive procedure and an outpatient procedure also, I usually can have a patient back at their desk job or office job the next week after they have the procedure.
All right, there he is, Dr. Jason Williams, the go-to doctor when it comes to back and neck problems. All right, thank you, doctor.
Thank you so much, Jim.
I had back pain, I had neck and shoulder pain, and my breasts were large, and it made wearing certain styles of clothing just undoable. Over the years, I've gone to physical therapy for my back and neck and shoulder pain, and it would help for a while. And then after a while, it would just go back to the old, same old, same old. And I've taken muscle relaxants, and I would take prescription pain medicine and over-the-counter pain medicines, and it was just not working for me.
Rosetta came to the office for a consultation for breast reduction surgery. She, for her tiny frame, she was very disproportionate. She's always had this, and she's been self-conscious of this since she was a teenager. I believe she was a G or an H, which affected her quality of life. She wasn't able to really engage in too many activities, sports activities, a lot of running or exercise, and she was having a lot of back and neck pain.
I ended up deciding that it was time to do something more permanent to alleviate the situation. And my primary care had recommended Dr. Angobaldo to me. And I went in to see him, and I immediately clicked with him and thought it was a good fit.
Breast reductions can help solve a lot of these symptoms that people are suffering from. Rosetta's surgery took about 4 hours to do, which included liposuction of her lateral breast tissue and her axillary tissue. She has a very nice result. We removed 3 pounds, a little over 3 pounds of breast tissue. Just imagine if you had a heavy gold necklace with 3.5 pounds and you've been carrying it or wearing it for the last 20 years. So just having that reduction in weight was a huge benefit for her, and she felt it immediately.
I'm looking forward to the fashion options that I'll have now and just looking proportioned, no more pain. I'm just really excited.
Getting an MRI for some can be a scary situation, but at Preferred Imaging, they have a way of putting you at ease.
I never had an experience as I had with any of the other MRIs I've had over my lifetime. I came here and I thought I was back at my own house, and the people were so welcoming and caring. Over here, they were very concerned with my state after the MRI was finished, so they have chocolate cookies, they have candy, they have whatever you want, water, or so forth and so on. Sit down and wait and rest. This is unusual for me as a patient. I'm really happy that the doctor and the radiologist found some specifics that made my procedures less than they would have been and much easier for everybody. So I'm very appreciative of Preferred Imaging and its staff.
Having that peace of mind was very important, because once I found out that I was going to stay off for just some time and I realized it wasn't like a rupture or something like really severe, that really kind of eased the burden within me, and then I kind of can project and have a game plan as far as when I want to get back out there and start working out again and running. Gave me a lot of peace of mind.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, PAMA's here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
I was experiencing chronic migraines 24/7, so 24 hours, 7 days a week. The only relief I was getting was sleep. So I would be willing to try anything. I would go to a neurologist. He tried every medicine in the book. Couldn't figure it out. He says, I met a doctor with the new procedure for stimulation for chronic migraines. Okay, let's go and let's see what happens.
The specific treatment we do here is an implanted neurostimulator for severe headaches. It's a unit that goes completely under the skin. It's somewhat akin to a pacemaker for the heart. There's a very small battery that's implanted under the skin, and from the battery, typically 4 very thin little plastic covered wires are passed up under the skin, 2 in the back of the head, and 2 of them end up right above the eyebrows. It's all under the skin. In fact, you can't see any scars or lumps. But once it's in, when it's turned on, they'll feel just a very mild tingling sensation in the front of the head and the back of the head. And by certain mechanisms, when they feel that, it very commonly either stops or dramatically improves their headaches.
After the stimulator was put in, I could see a dramatic change. I didn't have to take any medication, except for a cold front coming in. I would just take a daily Advil Sinus or a Tylenol Sinus just to kickstart it. And then once I get my headache under control, the stimulator could take over. That's when I knew this was going to work.
Michael had these severe, basically daily devastating headaches. Michael Parker kept on with life. He refereed the sporting events around here with the kids. So he was fighting through it, but it was still greatly limiting him. So it's been a couple of 3 years now to put it in. Michael has done great.
Whoever has migraines out there, take a look into this, because this can change your life, because it has changed mine. I would drop dead to save that man, because he saved my life.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
I'm a veteran. I've had 13 years active duty experience and been deployed a couple times. My first concussion was jumping out of airplanes in airborne school. Hit my head pretty good. And then in Iraq, shortly thereafter, I was leading my platoon of infantry soldiers. And on a mission, we had our lead vehicle hit by a roadside bomb. The shock of the explosion caused me to have a concussion. And didn't lose consciousness in that time, but had kind of some fogginess for a while. My third concussion was when I'd gotten home. I was doing a hand-to-hand combat course and got hit pretty good and actually lost consciousness for 20 minutes.
One of the problems that we're treating here at Texas Sports Hyperbarics is concussions and traumatic brain injury. And it is used to increase the blood flow to the brain, and there is good evidence that the increased oxygen that you get while in the hyperbaric chamber increases or speeds the healing of brain tissue.
I've just started noticing over the past few years several episodes of what I call fogginess, just where I can't concentrate as well. I've even noticed times where songs that I've sung hundreds, sometimes thousands of times, I'll forget the lyrics right in the middle of the song. Luckily, about a year ago, I met the folks here at Texas Sports Hyperbarics, and they told me that they're doing research on veterans that have dealt with serious concussion issues. So I started coming to treatments.
It has been used for many years to treat traumatic brain injury, and there's an increasing number of studies out there that show that it is very successful in helping people with both post-concussion syndrome and traumatic brain injuries recover from the trauma to their brain.
I've noticed ever since then a significant increase in my ability to focus, my ability to remember. I don't forget lyrics nearly as much anymore. And just in general, just interacting on an everyday basis. That fogginess that prevents me from being able to have a normal life is gone. It'd be neat if veterans knew that, hey, if you've had concussions, if you come home and you're having issues trying to focus, having issues remembering even the little things, you know, there's help. And that's something that I think everybody should know. All veterans should know they don't have to live with the effects of war.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in the Dallas-Fort Worth area that help change people's lives. And for more information on any of these outstanding doctors, head to the website, bestdocsnetwork.com. That's the place to go to find the doctor just right for you.
Absolutely. And if you have a question or comment for us, we'd sure love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.